Okay, I am going to give you a demonstration now on how to give IV push medications. I've shortened up a little bit of this because I know you've been taught last semester how to draw up medications. So I've got my different medications that I'm going to give. This one I've got 1 ml. There's no bubbles in there. I've got it right where I need it to be. It's good to go. This is another medication we're going to give. It's also 1 ml. There's no bubbles in it. You know how to draw up from either single dose vials or multi-dose vials. Just remember, for multi-dose vials, you put the air in and then you draw it back. Single dose, you really don't have to put air in there, you just draw it back. So I'm going to give a compatible medication, IV push. I'm going to give a medication that's not compatible with what I have running here, because I've looked up all my meds before I go into the room and figure this out. And then I'm going to give a small medication that actually needs to be diluted. So those are the three possible things that you may have to do for your skill test out. So I've got my 3 medications, and for this purpose I have got 2 flushes in case it is not compatible, and I've got some other normal saline in case I need to dilute my medication. And that's pretty much what I need. So I'll start with the easiest one. I've got my medication. I've done my 6 rights. I've done my drug route, patient amount, and time, and then I'm going to document it correctly. I've done all the rights. I've identified my patient. They've told me their name and date of birth. Make sure you remember all those things. This is compatible. I looked it up in the Micromedics, and it does say it's compatible with both my primary and my secondary that's running. So we're good to go. I don't have to do anything. I don't have to do any flushing. I don't have to do any stopping of the machine. I do need my alcohol wipe, and I need to scrub my port for 15 seconds. Now, I've got a needle that obviously, or I've got a syringe that's got a needle on top, but everything is needleless when you give medications. So if you take this off and the needle is there, you can tell right away you're doing it incorrectly. Make sure you take the needle off. You just need this, and you're keeping it sterile. You luer lock it onto the port, the closest port to the patient. And then the things you need to know first is, does it need to be diluted? No, this one does not. What's the rate of administration? So I'm going to say I looked it up, and it needs to be given over 30 seconds. Then we have to obviously know if it's compatible or not, and I already told you that it is compatible. So I'm going to just keep looking at my clock, and I've got 1 ml over 30 seconds. That means a half a ml over about 15 seconds, and I'm just going to give it accordingly, giving a little increment at a time. And then fluids going through. Another small increment. The main thing is that you're giving small increments, letting fluid going in between so that it doesn't burn, because sometimes medications can burn if they're really hypertonic or just depending on what they're composed of. So we've gotten this medication given over the 30 seconds. Take it off. I would go ahead and put it in the Sharps container, and then obviously I would go and document. So we've got that going. Now the next medication that we're going to give. I've got 1 ml here. I've done my 6 rights. I've identified my patient. I've got everything ready to go. I've got my medication, and it's not compatible. So I need 2 separate flushes. I can't use just half and then the other half. 2 full separate flushes, and I've already gotten the air out of them. Flushes always come with a little air, so make sure you get that air out. Now, when it's not compatible, that means it can't mix with either your primary or your secondary or both. So it can't mix with it. That's why you have to stop. And then it'll say stop all. Yes, so now none of them are beeping. That means it's stopped. The first thing I'm going to do is flush, because obviously in this tubing here, I've got these types of fluids going. I'm going to scrub for 15 seconds. I'm going to get my first flush, put it on, and then I'm going to clamp. I know I've got that stopped, but I still like to clamp just to make sure that all my fluid's going forward and that I'm just clearing this portion. So I would go ahead and push the entire flush through. Now the next thing I'm going to do is get my medication. And again, take that needle off. And this has not touched anything, but you know, just to be on the safe side, keeping this sterile. Let's go ahead and clean it off anyway. 15 seconds. Luer lock this on. Now, I looked earlier, it does not have to be diluted. We know it's not compatible, and this one has to be given over 30 seconds as well. They come different. Some medications are over 1 minute, 2 minutes, 30 seconds. You have to make sure you've looked them up. Now, just to be on the safe side again, I'm gonna clamp the tubing, just because I don't want it to mix with anything. So I'm just a little on the cautious side, and I'm watching the clock, and I'm again giving it in increments. Watch the clock. Same thing, if it's over 30 seconds, I want half of it over 15 seconds and maybe a little bit less as you go with the increments, just so it goes over that 30 seconds in even increments. So we'll say that that was the 30 seconds. Take that off. You be quiet. The next thing I need is to flush again. I'm gonna be safe. Scrub it for 15 seconds. Here's my second flush. Luer lock it on. Now you're gonna flush this just like you did the first time. The only thing you gotta keep in consideration is that you're going to go at the same rate as the medication. So if, as you're flushing, that same rate, so 30 seconds. So again, I think I'm gonna go ahead and clamp, and then I'll just go slowly give, and just mostly like all this stuff here, over 30 seconds. But I would just give that whole thing over 30 seconds. Looking at the clock, watching your increments. Because the thing is, if you just go ahead and push this flush in, then, because a lot of your medication is still in the tubing. So that's why you don't want to just give it a big flush, because then it's just going to go right in and it defeated the whole purpose. So that's the important thing to know about that second flush. I'm done with it. Checking the site, checking my patient to make sure that he's, adjusting to that medication. It's going right in the vein, so it acts quickly. And then I would go ahead and start my machine up again.